What's going on, ladies and gentlemen? It's your boy Nurse Bass back with another video. And guys, in this video, what I wanted to talk about were 4 reasons, maybe more, 4 reasons why you feel incompetent in nursing school. Let's dive in.
Are you listening? Nurse Bass. Beast mode. Grinding.
So I think first and foremost, it's very important to understand that you are not alone in these feelings. I brought it up before, but your classmates, your cohort sitting in those seats next to you may have some damn good poker faces, but understand this, they feel the same way you do. And it's this feeling of incompetence, sort of along the lines of, am I cut out to be a nurse? Do I deserve to be here? Did the admitting committee make a mistake whenever they said, hey, yeah, you can come on in, you're allowed through the doors? Did I make the right choice in choosing this career path? If I manage to pass all of my nursing school exams and pass the NCLEX, how well equipped am I even going to be to care for a human life? I think all of these feelings are certainly understandable, and again, ones that you're not alone in feeling. You know, whenever you take a look at the end goal of caring for human lives, like what greater calling or responsibility could there be? It's very, very important. And so it's a calling that is certainly stress and anxiety inducing. It's normal. It's normal to feel incompetent, and it's normal to not feel worth it, if that makes sense. It's a horrible feeling, but it's normal. What I wanted to do is kind of break down 4 reasons why you probably feel this way. The first one is that all of this information that you're learning right now is all brand new information. Now, most folk have not taken their sciences recently. A lot of folk may have taken their microbiologies or their anatomy and physiologies 2 or 3 years prior to being accepted into nursing school. But even if you did just take those A&P courses the last semester, the semester prior to where you are right now in nursing school, even if all of that information is fresh in your mind, all of the information that you're learning now in nursing school is still brand new information. It is all of these pathophysiological disease processes that you've never heard of before, all of the pharmacology and medications necessary to treat those pathophysiological disease processes. It's all brand new. And on top of that, all of these test questions that you're being asked are structured in a completely different format. Again, you know, this is not regurgitation of memorization and regurgitation. This is memorization and committing this information to the long term. So you're being tested differently, and all of the information that you're learning is so new, right? So anytime that you're entering into a new, you know, you guys probably remember what it was like whenever you went from 8th grade and you first stepped into 9th grade into high school, right? Like you felt like you were the boss of campus in 8th grade, right? Like, yeah, I've been through 6th and 7th grade, son. I've been here, you know, I'm about to graduate and go on to high school. And then once you step in as a freshman, you're like the newbie on campus. Sort of a similar situation mentally or academically, at least, whenever you go from those prerequisites and then you begin to dive into nursing curriculum. It's that beast hitting you in the face. It's like, this is all brand new, and you can kind of get like that deer in the headlights look. But not only, 1, is all of this information brand new. 2, you're being inundated, absolutely overloaded with information, lectures, and assignments, care plans, med cards, clinicals. You know, one of the things that they told us during our nursing school orientation was that you have to be flexible, right? That's what they told us. They've stressed that to the max. You got to be flexible. There's going to be things that are going to pop up, assignments that are going to pop up, things that we're going to ask of you that were not planned. They were not on your syllabus. And guess what, bro? It's on you. You got to do it, right? So not only are you being given all brand new information, but now you're being absolutely overloaded to the max with assignments, lectures, tests, quizzes, ATI exams, this, that, and the third. It's a lot. It is a lot. And also still bearing in mind, hey, I got to be able to care for human life at the end of this. So again, it's very stress and anxiety inducing, and it's one that would absolutely, as you're being overwhelmed, like, is it just me that feels like this? As you're being overwhelmed, those thoughts are absolutely going to creep in. Even if you're doing well on your exams, even if you were doing well on your exams, those thoughts are still going to creep in. Like, am I going to be able to care for these lives whenever I graduate? It's absolutely a normal feeling. So please Trust and understand that.
Hey guys, real quick, I just wanted to let you all know about this amazing company called nursing.com, whose sole purpose is to help prepare aspiring and new nurses for success in this rewarding career. Links down below. They have 4 brand new academies available for whatever stage of the grind you're in. The Pre-Nursing Academy for those aspiring, the Nursing Student Academy for those in the trenches, the absolutely stellar NCLEX Prep Academy with over 99% pass rate, and a program designed to help the new grad nurse navigate this new and intimidating profession. Just pick the path that's right for you. But if funds are tight, don't worry, because nursing.com has a ton of other free resources available to you as well. One day, patient lives will be in your hands. Study like it. Links are in the description. Love you guys. Grind on.
The third reason is that you're only being taught about 10%, and that's an approximation from your boy Nurse Best. About 10% of the information that you need to know to be able to practice as a nurse and care for that life that I keep talking about. Nursing school absolutely teaches the bare minimum foundational knowledge necessary to pass the NCLEX. That's really what it does. It does not prepare you to take care of that life. Now that is a massive distinction. I probably should have put a little bit more emphasis on this third point. I just thought about it in that light. It is not preparing you to care for that human life. It's not. It's not. It's preparing you to pass the NCLEX. If you pass that NCLEX, it gives that school good NCLEX pass rates. They continue to receive funding. They continue to receive students who want to apply to that program because, hey, if I apply to that program, I'm gonna pass that NCLEX and therefore get my foot into the profession that I'm trying to get into. Understand that. If you didn't catch that point, rewind this video and play that part again. I talk too fast sometimes. So understanding that it only prepares you and gives you that foundational information necessary to pass an exam, national certified exam, obviously, without saying, you're going to feel underprepared, even if you pass that NCLEX. Dude, I maybe would make a separate video on this. If you guys have recently passed that NCLEX, and I want you to be real, please be real, because these people out here who are watching this video need to know this stuff. They need to know they're not alone. Be real. Put it down in the comments. You just passed that NCLEX. How prepared do you feel right now to go out and care for 2, 3, 4 patients? And their lives are in your hands. You got to pass meds. You got to make sure you know all this stuff. I didn't feel that way. I did not feel prepared at all. I didn't feel prepared, honestly. If I'm being honest, at least until I at least had a year under my belt. And I wouldn't even call it a feeling of being comfortable. I felt like, okay, all right, I think I can do this. So just understand that you're not getting out of nursing school. You're not passing the NCLEX fully equipped. You're getting about 10% of what you need. The rest is going to be learned on the job through experience, getting those reps in shift after shift. And then the fourth thing, which is kind of a summarization of everything I just said, but nursing school is just purposefully difficult. It is difficult. Anybody would attest to that. It is purposefully difficult to weed out those who don't really have the heart for it, who don't really want to be there, who aren't going to grit their fucking teeth and grind through it because it is what is necessary in order to pass. So guys, just understand this, man. You're not alone. Please understand that. That's like the most important thing, that feeling of helplessness and I am all alone and feeling like this. Everybody around me seems to have their shit together and I'm the only one. Did I make a mistake in choosing nursing as a profession? That's a crushing feeling. Crushing. God, you're not alone. Like, understand that, please. Take nothing else away from this video. Lean on your peers around you, or those who you were close with and would be able to confide in, like, listen, man, I don't feel like I got this. Lean into your professors, those who are helpful, those who you trust and would confide in. After hours, hit those offices. Like, do everything that you have to if you're struggling academically to try and help bring those grades up. And if you're struggling spiritually and internally and emotionally with feelings of inadequacy, lean into those who you confide in most. And if nothing else, drop a comment down below. Let me know how you're feeling. Those of you who have already been through the grind, let these folk know they're not alone, man. Any personal testimonies, drop them down below. It's your boy Nurse Bass. I hope that you enjoyed the video. If you're new to the channel, be sure to hit that subscribe button and the like button if you want to, because it helps with the algorithm. And any comments or questions that you have, drop them down below and I might make a video on them. You never know. It's your boy Nurse Bass. I'm putting out videos every week to motivate, uplift, and inspire you to be the best damn nurse you can be. And please fucking know that you can do it. Like, just know that you can do it.